Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I'm your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me here to learn and to grow. I always appreciate all the support. I know there's a million things you could be doing, but you're taking the time to join me and my amazing guests to hear their insights. So thank you for all of that. Off the top, as always, I want to share one quick request, which is if you could please share the podcast with somebody. I know there's going to be a lot of great insights in this episode. Send a link to a friend, post it on LinkedIn, put a screenshot on Instagram, whatever you could do. And of course, please do leave a review. We, for whatever reason, had a glitch on Apple Podcasts and lost all our reviews a few months ago. And we're slowly climbing back up. But those reviews really help the podcast to show up and find more of our amazing colleagues. So thank you for everything so far, guys. Today's episode is part number 3 of 3, the third and final installment of this partnership that we have with EssilorLuxottica. I want to say a big thank you to EssilorLuxottica off the top for all their support this year and bringing on amazing guests to talk about myopia management and how we can help more of our young patients in our office. And today we have none other than Mr. Simon Robert coming on the show for the second time. He is a Senior Director of Corporate Affairs and Strategic Partnerships at EssilorLuxottica. That's a mouthful. I'm glad I got through that without messing that up. He is also a fellow Stoic, likes to read his Stoic philosophy, and we always get to kind of chop it up over that, which is always great. And he built his own house, if I'm not mistaken. I think I remember you saying that, which is pretty amazing. We might have to touch on that again, Simon, but thank you for being here. And Dr. Patrick Simard from Montreal. Oh, did I get this right? Montreal? I was going to say Quebec City for a second. Dr. Patrick Simard from Montreal, who is a co-owner of a group private practice. He is a member of OSI, and we actually just connected last week at the OSI National Summit. But more importantly, he is a clinical instructor and lecturer at the University of Montreal School of Optometry. One quick fun fact is that Dr. Simard is a 3D printing enthusiast. And if you don't mind, I'd love to show your fun project that you just printed there right off the top, just so we get it out of the way.
Yeah, I'll show you my Halloween costume.
Your Halloween costume. Okay. I know this is not the topic of discussion, but I just want to get... All right. That's pretty amazing. Anybody who watches The Mandalorian, you're going to recognize that helmet. That's very cool. Let's see. Oh, yeah. And it fits. That's maybe the more important thing. It actually goes over your head. That's awesome. Great job. Okay. Well, thank you guys for being here. And again, thank you to EssilorLuxottica for partnering and supporting. So why don't we jump right in? Let's talk about myopia management. It's been a really big discussion topic this year. Of course, there's been amazing tools and treatment options that have kind of come to the forefront over the recent, couple of years that have really helped to support optometrists in practice to help to treat our patients. But let's talk a little bit. Maybe we'll start with Simon. Let's talk a bit about EssilorLuxottica specifically, and what the company is doing to support this and support optometrists. I know there's been a lot of great partnerships, of course, bringing on great guests on the podcast here, like Shalu and others, and Millicent Knight recently that I spoke to. Please tell me, maybe a little bit more information so the audience can understand what EssilorLuxottica has done at these different levels.
Yes, thanks, Harbir, and yes, proud that it's my second time attending this great podcast. So you might have noticed I'm the non-doctor in the room. My background is sustainable development. Right. When I looked at the eye care ecosystem, and that was my task within Essilor, is how do we help every Canadian have access to good vision? The key statement there was that everyone needs to have a comprehensive eye exam, hence sit in front of an optometrist. Right? And when I looked at the epidemiological data, looking at the current situation, myopia stood out right away. We have an amazing product. And we can talk about it, but it's really how do we get more children, in this case, in front of optometrists? How do we get more optometrists to start managing myopia actively? And we supported different initiatives like this. And we can talk about the Global Myopia Awareness Coalition, which we as a global company are part of. And you alluded to it with Dr. Knight. One of the elements that we've seen also is our partnership with associations of optometry across Canada. The Canadian Association's work is incredible right now. Bill C-284, for those following the news of the federal vision care strategy, and it's now in the Senate. So if you follow that, it's amazingly entertaining work right there, but it passed the House. It's going to Senate. One of the things that we were advocating as a company was that myopia management be recognized as a public health issue, because it will be, and it will be a tremendous cost for society. So our company has been here and there supporting University of Montreal's work, donating equipment, sponsoring. Dr. Jones was with you recently, and so we supported her retrospective study because we felt that, yes, there was a gap. No, not every child was being treated and followed through myopia management right now. So it's a multi-pronged approach. You're going to see, we're going to have an interview with Dr. Powell on CTV News as well. And so we're trying to do a multi-pronged approach to myopia management, as we need more parents to be aware. We need more parents to book an exam with you guys, and we need them to have the proper solutions out there. So we even sponsored and partnered to develop this. I have no work to do in this, but I'm lucky that, you know, Dr. Simard is one of the author behind that amazing book. So if I'm doing free promo for them, I don't have any royalties out of this, but it is a great book that explains everything. It has a whole decision tree if you're wondering how to do it. So it's a great asset that they've built to help everyone. So we've been at multiple level engaged in promoting this new category that we like to say internally, but really to spearhead that development of managing myopia in children.
That's incredible. Yeah, definitely a lot of different levels there. And I forgot to mention that. Sorry, Patrick, off the top, you're an author. You have written a book, Managing Myopia One Child at a Time. That's great. We're going to talk a little bit more about that in a second. But that obviously, above and beyond all of the qualifications I've already listed, that is another one of those things that really validates you as an expert in this space. So I'm also, for that reason, grateful to have you. But to go back to what you're saying there, Simon, really interesting point. You know, I think a lot of us as optometrists who are working in our practices, we're thinking, how do we get more of our existing patients, this is an important thing to do. How do we get more of our existing patients to buy into this myopia management, or the parents? But we have to think broader. How do we get more people in the public just aware of this problem that we're facing, this increase in prevalence of myopia? And that's where the public awareness campaigns and the media campaigns come in. It's a lot easier for a corporation to put money into that versus individual optometrists trying to get out there and get on the news. We can do it. We probably should try, but it's a lot more effective when you can do a local or national campaign like that. So that's very cool that EssilorLuxottica is working on all those levels.
As I said, it's not a simple issue, right? It's from a society's perspective. In the office, I mean, the treatment protocols and all of that, even for an OD that wasn't doing it, it's complicated. As a society, it is furthermore. And that's why we also had the amazing Anne Tran on your show as well, because it seems to be a holistic approach that you need in the office, and the whole team needs to be on board. So as a market leader, we can really get in there and provide the proper tools for you to expand. And I think opticians, optometric assistant, and your staff needs to be part of that solution. I'm sure Patrick has a lot to say about that as well.
It's vital, you know, coming from my personal perspective of having a myopia management practice and that being part of our practice, having the staff buy-in, but also making sure everyone's on the same page of how we're going to incorporate this and, you know, what the protocols are. Like you said, that decision tree is really important, but I will say, like, if you need to kind of know the system. Like, if I turn this wheel, what else is going to turn the office, right? If I'm prescribing this thing, which other person in the office is going to be involved in this process? That needs to be set up ahead of time. Otherwise, you're walking out the exam room like, okay, who am I bringing this to? That's really important. I wanted to say, you know, I mentioned off the top, this is the third and final installment. You know, if you haven't checked out the first two, please do go back and check those out. Everybody in the audience who's listening or watching, they're not sequential. It doesn't matter which order you listen to them in. So finish this one, please, and then go back and check the other two. So the first one was with Dr. Millicent Knight and Dr. Shalupal, the very lovely Dr. Shalupal from Toronto, Ontario. And the second one with Anne Tran, who really had a great that insight of that holistic approach and training the staff, and that really great insight from her perspective was very helpful. So, Dr. Simard, let's move over to you. Let's start from educational perspective. We'll work our way to the clinical side in a moment. But You work with students both in the clinic and at the university as an instructor. I'm interested to know what's the shift in, since you started or over the last 5 to 10 years in the interest level in students or their understanding of myopia management. Do you see, what's the shift in the attitude? Are they actively seeking to learn more because they want to incorporate this specialty into their practice in the future, or is that different than what it was a few years ago?
Yeah, it's all about training, and we're lucky enough at the school that we've started myopia control early on in the mid 2000, first with orthokeratology, and then we had the soft contact lens, and we also have at that point the myopilus line of lenses. And we develop an algorithm that use every tool available on the market. And we also have a huge myopia clinic. So students are really exposed to all those difficult cases that don't typically respond to the basic protocol of myopia control. And now it's going to be 10 years in 2024 that we have a dedicated myopia control lecture. And now we have 14 hours for fourth years students, so they can look at all aspects of that. That's mainly why, as a group, we wrote the book on that. So to clarify all the algorithm and how we can incorporate all those tools from different companies into the management of myopia control.
That's huge. You have to be educating the students on it for them to even know about it and have the interest in it, right? And that's amazing that University of Montreal has been doing that for so many years and has so many hours worth of education on the topic. That'll really give the students a chance to learn about it and see if hopefully they'll be interested in it, but at least know enough that they can implement it when they do get into practice. Simon, could you show the book one more time? I want to just shout that out again. So since Dr. Simard referenced it again, for everybody out there, if you're watching, Simon's got it holding up on the screen here, but if you're listening, Managing Myopia One Child at a Time, look it up. I'm going to make sure I grab myself a copy. And because I think there's always going to be something, even for those who are practicing this regularly, something
it's
there to learn.
It's in 4 languages now: French,
it's
English,
in 4 languages.
Spanish, and fairly soon Chinese.
Wow.
Yeah, that's
very good. That's awesome. It's going to become a global.
And it is. And I'm going to say the last third of the book are case studies, like really how they applied it and everything. So it's really clinician oriented. It's not just an academic textbook. I mean, if I was able to read it and understand some of it, I'm sure your listeners are going to be way better off of understanding everything in there.
You're being humble. You're a very smart man, but at the same time, the fact that it has the clinical information is huge. Those case studies, because it's one thing to read a study and say, okay, the data says this, but like, how do I apply that, right?
Exactly.
That's very cool.
And I'm going to add as well, and we had that discussion, Patrick and I, at the academy in Louisiana, about all the new research coming out and the contest of my study is longer than yours, and I measure things differently. So, and I'd love to hear, Patrick, if I may, about these elements, because I think it's great that so much information is coming out, but there are some risks associated with that.
Sure.
Yeah. To make sure we prevent the consequence of myopia, we also need to be sure we prescribe the right product, meaning that we need to choose those products that have strong studies behind them. We need prospective, at least 2-3 years study with control group. We also need to look at the axial length reduction between the device group and the control group, and not only the percentage wise, it's important, but also to look at those data.
Sorry, that like the absolute number of like
exactly what
one diopter less progression over a period of time, like that number versus 60 something % less progression. Those are both important to look at.
Exactly, exactly. And also, as we move on with more and more product on the market, we'll also need to look at those other small things. So how well the patient adapt to those kind of, of device. Are they able to wear them all the time, especially with the glasses? Because when you are -1, -150, the reflex when you read will be to remove your glasses to see clearly. But this is a pitfall because you won't have any effect, and this is the time where you need it the most when you read a lot. So
Right.
those kind of small details you will differentiate between a product that will be a very good first step in screening for those fast progressor compared to other devices that we only have white paper and don't have strong peer review published article behind them.
That's really great. There's a couple of things we're gonna move over to the clinical conversation in just a second, but I want to go stay on the studies and the research side of things for a moment. That's an important thing because there are so many products coming out now, right? As expected, when a sector is growing and there's opportunity there, you expect companies to come out with products to kind of fill the need in the space. But it's going to become more and more important for us as clinicians to like be able to distinguish the the studies and which is legitimate, which is valid, credible, whatever the word is. Are there any other tips on what to look for? You already mentioned a few, like looking at the absolute number of change or the difference in change between the control and the product. Anything else that you might want to say? Like as a clinician, I'm reading this study from somebody that I want to make sure is like legit, and they're not just skewing the numbers or trying to sell me on. They're just giving me like a little piece of data to like make it look really cool that their product does really well, but we're missing the big picture. And then the other thing on that very long question is, where does axial length come in, and how important is that?
Yeah, for your first question, look at the demographic of the test group and the control group also. Look at those data to make sure those group are quite similar, and look how the results are presented. Like you mentioned earlier, the cumulative axial length reduction in elongation should be the term we look for, because what we want to prevent is the increased risk of pathology at the adulthood, and this is strictly directly related to the amount of axial elongation that the eye will show, especially in those 8 to 14 years old, where the eye can grow fairly fast. For your second question about axial length for us in the private practice and also at the school was definitely an eye opener. It will make everyone aware of the risk of losing your sight later on in life, and it will make everyone more proactive in their recommendation of going forward, even though you have a low amount of myopia. So one message that should be clear: if you don't have any axial length device, is to treat every -1 myopic child like it is already -6, because you don't know how long that eye is. Right. So you can do myopia control without those devices, but you just need to present that option to every child in your chair.
So I think that's important, and I think to the point of, I think we're going to talk about a bit of the early intervention and how important that is, regardless of where the number might be. The earlier you intervene, the better. But we just got. Sorry, you're going to hear a little baby screaming in the background. She's just finding her voice. It's funny. We just got axial length in our office. Now, we've been doing myopia management for, I don't know, 6 or 8 years in various forms, but we just got the axial length. So you don't need it to get started. Like, I don't want that to be, I think we all agree, we don't need that to be a hurdle or an obstacle to get into it and start helping your patients. But I think now having it and the way that the data can be presented with the axial length of really clear data points, and talking to parents in terms of percentiles and things like that, which they've heard before not that long ago when their child was a baby, and their weight percentile and the height percentile and things. It kind of presents it in a way that they understand, and you graph it. It really does change the buy-in from the parent side, but also, of course, from the clinician side, we have more data points to track this condition.
And there's some great tools as well, Herbie, and industry partners have that. Like we have the passport that you can give to the kids so that they can follow through. We have the risk factor sheet where you can highlight to the parents the fact that they're both myopic, and some environmental factors as well. So you can really easily show the parents the progression and the need towards it and what would be the consequences. So when you multiply their risks of pathologies further down in life, that's where parents start to realize that, this could be serious and there's an easy fix for it.
Yeah. From the Essilor Luxottica side there, Simon, I think one, and please tell me if this already exists, but that type of, so the passport, so we have parents come in, they hear, like, like when you go get your, what's the word?
Flu shot.
Your flu shots, or you're like, when you're a child, what's the word I'm looking for? Immunizations. When you're a kid, you take I don't know how it is now, but when I was a kid, you'd have a little passport, you get it like written down, you got this shot on this date as a child. But parents actually bring that into me and they say, can you sign it? Can you write the numbers? And I really like that because it keeps them committed and they feel like they have to stay on track with it. But going back before that, having some sort of pamphlet or some sort of information that we could present to the parent to say, here's the risk factors. Otherwise, we're drawing it up and kind of creating our own information, but having something already created, obviously, that again lowers the bar to entry for optometrists who are thinking about getting into the space.
And I think it's great because I'm seeing the Canadian Association doing some advocacy campaigns more globally. And I'm seeing, yes, JMAC. I mean, we've tried to bring JMAC to Canada, so now it's happening. The Canadian Association is now also a member of that organization. So it's really about making more noise so that everyone's on board with that picture. So we've invested in different campaigns. Honestly, do we see a direct return on sales specifically for our products? No, but that's what a market leader does, right? Yeah. I mean, we are trying to create the space to raise awareness. Is everyone going to benefit? Yes, and that's our goal in this. That's our mission and what we're about.
Yeah, you're growing the pie, and that helps everybody. So that's commendable for sure. Let's go. So talking about your product now, I wanted to turn to clinical a little bit. Dr. Simard, let's talk about Stellest. Of course, we don't need to skirt around the name of the product. It's the Stellest lens with the HALT technology. Tell us how you've been implementing this, and maybe let's talk a bit about strategy in general. If you can share a case, like a young patient who's a -1, like how would you approach that, or a minus, you can give me examples of your own. An 8-year-old who's a -5, how would you approach that? Stuff like that. But let's talk about where the Stellest lens kind of falls into your decision tree and your prescribing patterns.
Yeah. First, one of the challenge we face in clinical practice is the disparity in the knowledge from the parents. We have parents that they're not aware of any treatment and their child is already -5. And then you have the parents looking for an option because their child is plano and the oldest brother is already -2. So this is truly a challenge to explain all the options. And when you have those kind of product that you can use as a first line of treatment to screen, it makes everything a bit easier. And this is where we place the Stellest lens in our algorithm. So as soon as myopia shows up, no matter the level of axial lens, we propose that option. And because we do a follow-up and there's a loop where we measure back axial lens, then we can customize and personalize the treatment over time and go with the other option we have in our algorithm. One of the other thing I really like about that product, it incorporates a bit the concept of a dose response, because the HALT technology, which is those 1,000 lenslets on over 11 ring from the center of the lens, the power of those lenslets are not the same the farther away you are from the center, and they're not the same depending of your amount of myopia. So every kind of prescription has kind of a dose response, and we now know that there's a sweet spot on the retina, that 10 to 20 degree of eccentricity around the foveola is where we need to create that blur to stop rapid eye growth. So for us, it has been a great tool as a first step to myopia management.
That's excellent. So that's your basically first line. As soon as a child is showing myopia as far as refractive error, that you put that lens on, because you know it's of course it's correcting the refractive error, so the child sees more clearly, and then it has that prescriptive or treatment aspect of it to help slow down the axial length. Even if we haven't measured axial length at this point, we assume it's going to be growing and progressing anyways. So first line, and then you look at, like, if it's if there's a more advanced case or something, you may add potentially a secondary therapy or something like that. You reevaluate.
Yeah, and depending on lifestyle, you can combine those glasses with soft contact lens, or even you can combine with low dose atropine in those cases showing a bit more progression. And also, one other thing that is good about that ophthalmic lenses is that we don't really have to worry about adaptation. I've not seen any child not adapt to those lenses. And also, when they read, no one complain about the design of those lenses when they read through them, which is a great thing, because the likelihood of them removing them when they read is really, really low. That's why probably they're so effective. Kids wear them almost all the time when we prescribe them, which helps a lot.
Right, of course. And we know that the longer they wear them, the more effective they are. I always tell parents, think of it like the glasses are giving the kids' eyes medicine. So the longer they keep them on, the more medicine goes in the eyes, and
that's great.
That seems to resonate. This is I thought maybe you could help me with this one. So when I've found these treatments to be very effective, right? So you're following kids over a year, 2 years, and child first came in, they're 6 years old and they're already -2, and now they're 8 years old and they're only -250, or maybe even less than that. They really have, that progression has really slowed down significantly. And so I've found consistently the product works. But the interesting thing I have to try to explain to parents sometimes is, would it have continued progressing if we hadn't put the glasses on them? And of course, like, we can't compare. We can't say, well, if we didn't, it would have been at this level. But do you have that conversation with parents? And if you don't mind, like, how do you navigate that? Like, it's working. I know it's working. You have to kind of believe me. It would have most likely continued to progress if we hadn't put this on their eyes.
Yeah, it's kind of that's where, when you have axial length and you have the growth curve, you can easily show the likelihood of them continuing to progress, especially in those 8 to 14 years old. That it might not be the year after, but on a 2, 3, 4, 5 years span, their progression will most likely happen at a higher rate than without those devices.
Right.
The other point is the genetics. So for some parents, when there's one parent myopic, they often confess that they had the similar growth rate at the similar age of apparition of myopia. So for those kind of parents, it's quite easy to convince them of the effect of the lenses.
Yeah, and I was going to say that those curves do exist. When you go to your general practitioners and you see the size, and they tell you your kid is in the 60th percentile and everything. And I think you use Tideman a lot in those curves. So they do exist. And when you compare the kid to standardize based on your demography as well, right? That's always a challenge, finding the right pattern for your patient. I think that's the challenge. But as more and more people get into it, we're going to have better data to support that progression or slow down of the progression.
Right. That's excellent. Yeah, actually, to your point, Patrick, that's actually so true. I have so many times parents say, "Oh, that's exactly how it was for me. At this age, I had got my glasses or whatever it was." That happens very often, so it's a little easier for them to understand that. And also, like helping parents understand that we're playing a long game here, right? So maybe it did change this year, but like let's see next year, let's see the year after. Consistently, it slows down. I always use this analogy of stopping a moving car, like a rolling car. Like unless you're Superman, you're not going to stop it right dead right there. Usually you got to cushion it a little bit, right? So for the first 6 months, we might still see a little bit of progression as we're cushioning, and then slowly we start to see a bit more stability. And that's kind of been a consistent, clinical insight that I've noticed. So I really appreciate that. I want to hear any more thoughts, any final thoughts you want to share on what EssilorLuxottica is doing, and then maybe after that, Dr. Simard, maybe some clinical insights that you maybe want to share before we wrap up, or the other way around, if you guys want to take it a different way.
No, let me give you the last word, Patrick, and I'll
Okay.
honestly, and what we're hoping as well, Harbir, you have a great channel of communications to a lot of practitioners out there, and that's our hope. Honestly, is whatever partner you currently have, go talk to them. Get into myopia management. There are simple steps you can take to start doing it. And I mean, try the technologies. We believe that we have an amazing technology. We also know that you can't really compare clinical trials because of the pilot groups that are there. But at the same time, I mean, our results are great. So talk to your people inside of our company. We have the assets. We're really working towards that. We're hoping that it's going to move the needle, and that more kids will walk into your office and if they're myopes, to get treated for it, and so that it's actively managed. So, I mean, reach out to your industry partners, reach out to us. We're going to be there. We're going to support. And if you have other great ideas of how we can get more kids or better tools to develop, I mean, yes, you can do them yourselves, as you mentioned, Harbir, and I know you've built a lot of them, but work with us and we're going to make this streamline, and we're going to help you improve your practice, because in the end, your success is our success, right? There's no other way around it.
That's great. That's great. So yeah, absolutely. I would encourage everybody out there who's interested, or even like dabbling a little bit, even reach out to your reps and talk to your EssilorLuxottica rep as well, to learn what kind of resources, not just the product. I think that's the thing we get kind of hung up on, which product to use, but look at what resources are available, whether it's online learning, whether it's like physical things you can have in your practice, whatever it might be. Maybe it's a training like Antran was talking about. What are resources are available that will help you get into this? It's not just, here's a product, go sell it. It's like, let's do this together and let's make this better for everybody. So I think that's very, very important.
And if you want to reach out to me specifically, I mean, go on LinkedIn. I'm there, I'm active. Yeah. So don't hesitate to reach out if you have more, if you want more of a somewhat medically inclined discussion, although I'm not on NODI myself, but if you want to get into the science of it, please don't hesitate.
Yeah. Start the conversation with Memento Mori, and Simon will be all over it.
See, you're laughing, okay. But since we're on the show, I mean, we talked and go back to that other show, but I always carry the Memento Mori coin.
That's amazing.
On me, right? Go look at the concept, go look at Stoic philosophy. So that's I don't 3D print, but I do that.
Watch now, Patrick's going to start 3D printing Stoic coins now. That's awesome. That's very cool. I'm glad I forgot that you had that. You carried that around. That's really great. Dr. Simard, final words that you'd like to share from your perspective.
It's all about prevention. We don't have any device that make us go back in time. So we need to act early on. And we now have the efficacy and the device to do so quite easily. And I'm fully sure that we are in a paradigm shift. In 5 to 10 years from now, we'll fit only myopia control device for most of our patients. So it's a very good time to dig in, to start doing those kind of intervention.
That's great. It's a great time to be, I think, an optometrist in general, because of specialties like this. And the opportunity is just massive. Actually, before we wrap up, Simon, if you want to talk a little bit about the opportunity, like how many people are currently, implementing myopia management, and what that means as far as like what's available for the rest of us, because it's a startlingly low number of people that are doctors, practitioners who are really doing it.
Yeah, I mean, Dr. Jones' study showed that only 17% of the kids were actually seen. And she published that poster at in Louisiana at the American Academy meeting as well. That's very low. And think about it, for depending on your customer base, you're passing from single vision lenses to a myopia management solution. So if you're just doing it for the good business, do it, right? It's
Yeah,
probably
exactly.
very good for your business.
Yes,
if you're doing
yes,
it because you believe that it's your responsibility as a health professional to do so, then do it. And we've seen it. Undercorrection is not recommended. You really need to treat it. So either you want it, engage your teams. It's motivating. It brings the optician inside the world of you're offering a treatment. It's going to make a whole difference in someone's life. So
Mhm.
there's a lot of potential there. And again, pediatric patients, I mean, before you had the chance to say, I'm going to see more older patients, presbyopes, and I'm going to sell them progressives. That's how my business is going to run. And, you know, pediatric patients aren't as interesting. Well, with the follow-up exams, all the charges you can put, and, you know, depending on the province you're in, the codes are working your ways now, and governments are understanding
That's
that
right.
there's value there. And then you can supplement that with a myopia management solution. So from a business perspective, from a medical perspective, everything is guiding you into get into it. I mean, for whatever reason you wish, it will be relevant. It will make a difference.
Love it. Absolutely. And to that point, so we're very fortunate here in BC. Our association has been lobbying and working very hard. We've recently gotten the approval of these new codes that we can bill to the government, to the BC government. One of them is for axial length. It's within they're starting small, is within a certain group of kids above a -3 or something like that, -3 or higher. You can bill the government for axial length. But it's going to encourage more people to get into it, right, and to do more. And then, of course, as you said right off the top, Simon, CAO is really battling at the federal level with the bill and everything else that they're trying to do to get government on board with eye care, but to get insurance companies on board with things like these, specialties like these, to make sure we can bill and get reimbursed for them appropriately. But it's going to require more of us doing it, right? The government's got to see that, oh yeah, people are actually doing this. It's worth us kind of investing in it. So the more of us get into it, the better. So great. Thank you again, Simon. Thank you very much, Patrick, for being here. Appreciate your time. And thank you again to EssilorLuxottica for supporting us in this 3-part series on myopia management. Again, don't forget, go back and check if you haven't heard him yet. The first episode with Dr. Millicent Knight and Dr. Shalupal, and the second episode with Anne Tran. Really great information and insights that's applicable, I think, to all of us, whether you're thinking about getting to myopia management or if you're already in it. So please check those out. And thank you to everybody, as always, for listening or watching the 2020 podcast, Canada's #1 optometry podcast. I'll see you guys in the next episode.